So in this video, we'll study about the diabetic foot. One video has already been uploaded of this topic, but you can just review this in short as well. So what is diabetic foot? It is a long-term complication of diabetes mellitus. Epidemiology, obviously those patients who are having diabetes mellitus and elderly people ज़्यादा दिखने मिलता है. Etiopathogenesis, you have to remember three terms, that is diabetic microangiopathy. What happens that there is blockade in the blood vessels that supply to the lower foot. So that leads to hypoxic conditions in the lower foot or the lower limb. Then there is diabetic neuropathy, which leads to the loss of the reflexes in the foot, loss of sensation in the foot, and the arc of the foot is also changed, due to which the patient becomes more prone to trauma. And also the skin barrier is dry, which is likely effective for the microorganisms to get into the foot. And obviously there is hyperglycemic state in the body, so that is a good culture for the growth of the microorganisms. And fourth, you can say that the immunological status of the diabetic patients is already very low, so they are more prone to infections. Well, then you have nothing of classification of diabetic foot. In symptoms and signs, what will you have? You will have shiny skin, you will have lacerations. और अगर आप साइंस देखोगे तो लॉस ऑफ रिफ्लेक्सेस, लॉस ऑफ जॉइंट मूवमेंट, लॉस ऑफ सेंसेशंस. एंड अगर पेशेंट का अल्सरेशन हो गया, ऑब्वियसली देयर विल बी डिस्चार्ज फ्रॉम दैट अल्सर. एंड अगर पेशेंट का गैंग्रीन हो गया, then temperature tenderness will be present. What will be the approach? First is a clinical diagnosis, which you have already done. Then you have to send the patient discharge to microbiology lab for pus culture and testing. You have to go for pathology lab for testing the blood sugar. HbA1c is also to be done. Osteomyelitis अगर होता है तो मेरे को एक्सरे कराना पड़ता है. And the routine investigation that you do is, needless to say, that is blood urea, blood creatinine. Then you go for electrolytes imbalance test. Important है आप Doppler study करोगे to see the patency of the blood vessels of the lower limbs, especially the posterior tibialis artery and the and the dorsopedalus artery. Okay, finally you have the treatment. General treatment होता है, specific treatment होता है. General treatment of the care of the foot has to be done, in which you have to avoid the injury to the foot. Point number 1. Point number 2, that a patient should wear microcellular rubber shoes. And third is the foot has to be kept clean, especially take importance to the foot and the cleft, the toes and the cleft. और स्पेसिफिक ट्रीटमेंट पे आप करोगे ट्रीटमेंट ऑफ द डायबिटीज, ट्रीटमेंट ऑफ द अल्सर एंड ट्रीटमेंट ऑफ द गैंग्रीन. ट्रीटमेंट ऑफ डायबिटीज होता है, इंसुलिन दे सकते हो आप. प्रेसिपिटेटिंग फैक्टर्स लाइक अल्कोहल, स्मोकिंग, ओबेसिटी, हाइपरटेंशन को रूल आउट करना पड़ेगा, कम करना पड़ेगा. For ulceration, you have to do regular dressing and antibiotic therapy has to be given. For gangrene, you're just left with amputation therapy. And there's certain other drugs also which you can give. For example, the vasodilators. You can also give low dose aspirin to prevent thrombus formation, and you can also give prostaglandins, which will increase the blood supply to the area. So this is all about diabetic foot.